Mental health and substance use disorders affect people of all ages and demography and are extremely burdensome to society. This conference by the Center for Research and Information on Substance Abuse hopes to find a lasting solution to this problem.
The UN has found that about 10% of the population has been using cannabis over the last year. So that's like 21 million Nigerians, at least, out of the overall population. So it's a large amount of people. It's sometimes very difficult to get that because it's very expensive. That's one thing. It's very difficult to access it if you are not in big cities and you don't have the money. So I think that's a key priority, and that's, I think, why this conference is also looking at this, because it's a very important issue.
There's been so much focus on control of substance abuse in Africa, but the need for treatment centers and quality services for those with abuse disorder is key.
In some treatment centers, we had one lady to 90 men getting treatment. What does that say? That basically says we're not doing anything when it comes to the treatment of women with drug use disorders.
ECOWAS has already completed support for 8 drug treatment centers and rehabilitation centers in member states. Support to another 8 member states is underway, and God willing, when we meet here again in 2026, we shall be able to present a comprehensive report of the ECOWAS drug treatment and rehabilitation support in our member states.
The African Union's suggestion is that policies would need to be set up to address emerging threats of synthetic drugs in Africa.
One of the key frameworks guiding our efforts is the African Union Plan of Action on Drug Control and Crime Prevention, which is currently being implemented from 2019 to 2025. This plan is a critical instrument that outlines comprehensive strategies to reduce the supply and demand for drugs.
Sustained funding for substance use treatment programs, research into new therapies and policies that promote access to care are essential in addressing this public health menace.
The treatment needs to be cascaded to the local level. And the government do not even have the number of health personnel to do that. So for access to be easier, the capacity of those NGOs and those at primary health care level needs to be built.
As for Nigeria, it needs to strengthen treatment centers to ensure accessibility and affordability of services for those struggling with substance abuse. This includes expanding the availability of detoxification centers, rehabilitation facilities, and counseling services across the country. Uli J. Wapera, Arise News.